Okay, hello group. How you doing today?
Good.
All right. Very good. Well, you've been in orientation here in the operating room long enough to have the basics down for the procedures. And so today we're going to have a different kind of session. In today's session, we're going to be talking about something to help with decision making that also enhances critical thinking, and that's the use of algorithms. Are you all familiar with algorithms?
Yes.
Yes, you are? Okay. And I'm going to talk about computer algorithms, as you know,
Right.
because that's what most people are talking about. We're talking about or basic algorithms, or simple algorithms, they can be called. I've given you some handouts, and you can see that the expected outcomes and some algorithms that we're going to be going over are on the handouts. The outcomes that I want you to have are to be able to verbalize understanding of the use of and advantages of utilizing algorithms in patient care practices, particularly. I want you to be able to identify situations that are appropriate for the use of algorithms, because many are not, and demonstrate the use of algorithms in determining the next step with complex medical procedures. And the way that's going to work is I'm going to give you an algorithm for a complex medical procedure, and what you're going to do, I'm going to give you some scenarios, and you're going to use the algorithm to give me the next step. So, excited about that?
Oh yeah.
I bet. Okay, so to get started, algorithms, and again, these are problem-solving algorithms, they are a method for taking complex procedures and breaking them down into a step-by-step procedure. They're often used when the processes can be broken down into yes, no, or either or type of decisions and responses. Yes-no situations are really the ideal situations to use algorithms, particularly when it's important to make the correct decision, as it is in the operating room, as you know. The advantages of using the algorithm are that you can visually see every decision and determine your next course of action. They can also be used by persons who are novices or have little knowledge about what the algorithm's talking about. And it can save much time in trying to remember complex scenarios and situations. Some of the disadvantages of algorithms, of course, are disadvantages too. It takes a long time to develop one. But I do want you all, as we work through these, to be thinking of ways that you can develop algorithms in your everyday practice. While many are published, it's often helpful to develop your own for remembering tasks that you have problems solving on the fly. The example that I have of that is when I was a very brand new scrub nurse. I was scrubbed on a procedure, a face procedure, so my Mayo stand was over the chest. The patient had a respiratory arrest and ultimate cardiac arrest, and the surgeon kept saying, move that Mayo, move that Mayo. And I was froze and just couldn't do anything. So he eventually had to push me out of the way and move the Mayo. So you better believe that after that case happened, I took some time to sit down and think about what I was going to do the next time something like that came up, and I put it into yes-no categories. And while I didn't write it all out, I did have an algorithm as such in my head to work through the next time anything like that came up. Okay, now then, I want you to take a look at your first example. I'm going to put it up here on the board for you also, but you have your handouts. Okay. And the first example you can see here, it is called, does the lamp work? Or the lamp doesn't work. Okay, so this is a very simple algorithm. Obviously, the lamp doesn't work, so we're going to see what the problem is. You go down, is the lamp plugged in? No, then plug it in, and then go back and see the next step, which is the bulb burned out. Yes, the bulb's burned out, replace the bulb. Then you go down and says the lamp still doesn't work, so no. Then you buy a new lamp. And that's a very easy algorithm for everybody to get through and to understand, and seems a little silly to put on paper, but it does help understand algorithms. However, when you really think about it, I think about all the things I have sitting around my house that don't work, that I just don't take the time to think through what the issues could be, or just get rid of them. They're not going to be magically fixed. So, any questions about algorithms with that?
No.
No? Okay. Very good. Well, then the next thing we're going to do is go on to this considerably more complex algorithm. And this is on pulseless arrest. And you've seen this before because you've had this in your ACLS training. Okay. So, as you can see, the information on this algorithm is copious. There's lots of stuff there. There's lots of areas of action, and there's lots of places to make decisions. Okay, so what I'm going to get you all to do, because you're already familiar with this material, I'm going to give you 5 to 10 minutes to look over this algorithm and then come back, and I'm going to give you some case scenarios. And we're going to see how you do with utilizing the algorithm to solve the problems for the scenarios we come up with. Okay. Any questions before we do that?
No.
Okay, very good.
There's one of two ways, and either shoppable or not shoppable to start out with. And it's pretty self-explanatory.
Yeah, it goes right down the line.
Yeah. I guess the only place that really would make a jump would be if it's asystole.
Because you would have to go back up. But
Right, box 10. But that's the only thing.
Okay, so y'all have had a little time to refamiliarize yourself with this algorithm, correct? Okay, are you ready for your little scenarios?
Sure.
Okay, come on up here. Let's see, Meredith, you come up first. And you can look at the one on the board there. Okay, and here's your scenario. You go into pre-op, and you pull the curtain back to get your patient. The patient is just laying there, somewhat discolored in blue. Okay, so you implement emergency procedures naturally. You implement CPR, get oxygen, the patient already has an IV, you call for help. Somebody brings up a defibrillator, you hook up the defibrillator. You see that the patient is in ventricular fibrillation. Okay, so you're going to give that patient a shock, correct? Okay, what's the next thing you're going to do after you've done that?
We're going to resume CPR immediately and give 5 cycles of CPR.
Very good. Okay, very good. Okay, so now you've given your 5 cycles, and you go back and you check the rhythm again. Now the patient's in a systole. So what do you do next?
It says resume CPR immediately for 5 cycles.
Okay. And is that on the, do you follow the algorithm down for that, or how does that work?
Yes, you go over for asystole and go down from box 9 to box 10.
Excellent, excellent. So you go where it says over to the other side of the algorithm. Very good. Okay, very good.
Okay.
Any questions?
Nope.
All right, very good. You can have a seat.
Great.
For our next scenario, let's see, Lexi, you want to come on up?
Sure.
Okay, and you can use the scenario. I see you've made some notes there. That's very good. Okay, you're in the middle of an operation.
Okay.
You look up because the anesthesiologist stands up and says, "Oh my gosh," and the patient is flatlined.
Okay.
You immediately pull back, start emergency procedures, and go through the first part of the algorithm. You get down, and then you give 5 full cycles of CPR.
Okay.
After you give the 5 cycles on the algorithm, it says to check for a rhythm.
Yes.
So when you check for the rhythm, you see ventricular tachycardia. What's the next thing that you do?
I would, according to the algorithm, give 1 shock, and then I would resume CPR immediately.
Very good. So you go back over to the other side
Yes.
of the algorithm. Okay. Well, you all are having no trouble with this at all. Very good, Lexi.
Thank you.
Very much. And so, participating today, you've been good students, and let me know if I can help you with algorithms anytime in the future. Okay.
Okay, thanks.
Excellent.